Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today, we're going to continue on that journey of the Hashimoto's web. We're going to talk about Hashimoto's thyroiditis and the GI system, or the GI web. So last week, we showed you how Hashimoto's can be impacted by hepatic function, gut microbiome, the immune function, neurological tissues, and so forth. Today, we're going to go into more specifics. Hashimoto's and GI web. So what happens with Hashimoto's is that you become hypothyroid. One, it can create inflammatory processes, and two, it can decrease thyroid hormone. That in return can decrease GI motility. So what happens with that is, one, you're not going to digest your foods as well. Two, you're not going to have enzyme production. Three, you're going to get constipated. So one of the most common signs is GI motility issues with Hashimoto's thyroiditis. Next, we're going to have issues with gallbladder. I can't tell you how many countless women come in here with Hashimoto's thyroiditis, sometimes undiagnosed, and they've had their gallbladder removed, right? Their gallbladder becomes sluggish or it develops stones, right? It becomes a problem with Hashimoto's thyroiditis, and they become a problem to the point where they need to remove the gallbladder, right? These are unnecessary surgeries for a lot of these people if they can catch this early on and impact the Hashimoto's thyroiditis or hypothyroid condition, then you do not need to remove that gallbladder. However, if you have a sluggish gallbladder or if you had your gallbladder removed, what does it do? It will decrease the absorption of fat-soluble vitamins, right? D, E, K, A. These are fat-soluble vitamins that need bile acids, right? And it needs to be absorbed in the GI tract. But if you don't have a gallbladder, or if you have a sluggish gallbladder, you're going to have fat-soluble vitamin malabsorption. Dysbiosis, intestinal permeability, leaky gut, whatever you want to call it. Because of the inflammatory process, right, and the lack of thyroid hormone and communicating in the GI system, you're going to have dysbiosis. What that means, you're going to have malabsorption, right? You're going to have things that should not cross into the bloodstream cross over because the gut barrier is broken. So these larger proteins that should not cross over will cross into the bloodstream, creates more inflammatory processes. A decrease in T regulatory activity, right? Your immune system in the GI tract will start to suffer as a result. So things that should not have an impact in our GI tract will start to have an impact, right? So that with certain foods, with bacteria or H. pylori, it should be regulated much earlier on. However, if your T regulatory activity is off and your bile acid is off and your stomach acid is off, then you're more susceptible for infection in the GI tract. Impaired thyroid hormone. This is where T4, the inactive hormone, is converted to T3. So if you have issues with Hashimoto's, another thing that can happen is you're going to have impaired thyroid 1 biotransformation, right, to the active form. So it can make you feel tired because you don't have enough active hormones. Another one is altered gut microbiome. So patients come in, they have a gallbladder issue, so I can't eat this type of food. They have pancreatic enzymes, and I can't have this type of food. They start to lack the diversity of their gut as a result of a poor diet or a lack of diversity in the diet, and your gut microbiome will start to suffer, impacting thyroid hormone, impacting T regulatory cells, impacting gut permeability, impacting gallbladder function, impacting GI motility. Another one here is malabsorption of nutrients, right? If your GI motility is slow, then you're not going to absorb your nutrients as well, right? So malabsorption of nutrient or nutrient deficiency is very common with patients who have Hashimoto's thyroiditis. One, they sometimes don't even have enough stomach acid. They don't have enough stomach acid production to break down things like fats, proteins, and carbohydrates. Another thing that can happen is it can increase yeast cells and bacterial cells and eventually lead to inflammation or infection, right? So all of these things, again, each part of the web pulls on the other side or globally, right? So if I just pulled here, all of them will eventually be affected. If I pull over here, everything will be affected. If I pull over here, everything will be affected. You get my point, right? It's a web. So everything affects everything, just much like the body, right? You can't just have a pebble in your shoe and walk around and be comfortable. Eventually it becomes painful. And then your foot hurts, and then your knee hurts, and then your hip hurts, and your lower back hurts, right? Eventually it has a cascade. Same thing with thyroid, same thing with your liver, right? All your organs will eventually impact everything else in your body. Therefore, when we look at a patient who has Hashimoto's thyroiditis, we like to look at it as a web, because we know if you can just pull one or two things on this web, it could impact their health, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.